You know that fewer than 50% of ambulance providers in America use any technology in their ambulances? The rest capture their patient transport details from the time medics arrive on scene to the handoff at the hospital on a double-sided sheet of paper. But the average transport time is over 20 minutes, and the typical hospital handoff takes just 45 seconds. Roughly 46% of patient data are lost in the process, increasing time to treatment, the risk of medical errors, and the crush of rising healthcare costs. The MEDIVIEW platform by Beyond Lucid Technologies eliminates the use of paper in transit and closes the data chasm between first responders and the hospitals they serve. Incident and patient data are inputted digitally, securely, in real time, then routed wherever they need to go. To the hospital best suited to treat the patient's condition, to EMS headquarters, to the patient's doctor or nursing home or spouse. We move data throughout the pre-hospital to help medics and hospitals achieve max efficiency, even during a disaster. The MEDIVIEW platform by Beyond Lucid Technologies, making first response more efficient and saving lives one patient at a time.
Hi everyone, Michael here at Beyond Lucid. Today I want to show you MEDIVIEW Beacon, which is Beyond Lucid Technologies' Healthcare Information Exchange portal. This is designed specifically to give destination hospitals the ability to see in near real time patients coming into their facility as the data is being entered into the system en route to the hospital, as well as the ability to access the completed patient care record once the clinician has finished authoring it. So let me take a moment and explain the way this works and explain the benefit of utilizing this portal and provide you a quick demonstration on its use and then show you what it looks like. I want to quickly demonstrate by first showing you Beacon, then by showing you how quickly information sends from one device to another by demonstrating this in MEDIVIEW Mobile. So let's take a look at Beacon first. So what we have here is an instance of MEDIVIEW Beacon which is created for one of our agencies here in Colorado. Now the data shown here is obviously test data, but you can see here our dashboard that shows you a number of patients that we've already put into the system that's been transported to this facility. And the latest one will appear on the top. And going from left to right, we have agency, incident number, the incident date, when they departed the scene, the transport mode of the patient, the impression, the gender of the patient, the age of the patient, when they arrived at the facility, the PCR number, and then we have a view PDF link. Now over here on the right side, we have pre-hospital record search, and this gives you the ability to go in and search upon previous trips using the filters that are provided down on the left, and then the results will display in a grid on the center of the page, as demonstrated here. Next, I want to bring up MEDIVIEW Mobile, and I want to show you how quickly we can get data into Beacon. So what I'm going to do first is I'm going to open up a new patient care record. The first thing I'm going to do is I'm going to go over to the incident tab, and I'm going to give it an incident number, and I'm going to use example 50. Once I've done this, I'm going to head over to the patient page, and then I'm going to give it a male patient. I'm going to set the date of birth. To January the 1st, 1990, we'll have a 27-year-old male patient. Next thing I'm going to do is I'm going to go over to the drop-off tab. I'm going to select Castle Rock Adventist Hospital. Click Set as Destination. And then last but not least, I'm going to go over to the Review Submit tab. And I'm going to set the unit notified by dispatch to today's current date and time. Now once I've done this, then once the data actually uploads into the system and connects with our cloud-based service, I'm bringing up the sync panel. I'm going to show you that we've got about 26 data elements to upload, and once this is finished, this will be available in Beacon. So now we're set to 0. Now what I'm going to do is bring up Beacon, and I'm going to go click on the records page, and then you're going to see example number 50 with the agency, incident date, the male patient that we put in at 27 years of age. We've got the PCR number, and then I could click on the PDF, open up the PDF, and then this will give me the options to save as a PDF, export it into a NEMSIS v2 format, a NEMSIS v3 format, or even save it as a CCD. So I'm going to show you the PDF, and I'm going to click the structured data report, and then there we'll have the completed patient care record of that trip. So here's the thing. There's a lot of discussion right now in the market about notification systems. While these applications definitely play a role, they really are more applicable by the use of agencies who ePCRs can't move data into the hospital system this quickly. And they don't actually transfer the PCR itself, just the alert. In other words, with MEDIVIEW Beacon, you really might not even need a third-party alert system to bolt onto the ePCR, because the data that shows up in the hospital will do so within 30 seconds and contain not only the triage notifications, but also the patient's current historical clinical context. Plus, MEDIVIEW Beacon can be layered onto other NEMSIS v3 ePCRs if your software provider is willing to point their data into our Prehospital Health Information Exchange. If they are, we could take the NEMSIS v3 data, scale it up into a valid CCD, and then kick it out to the other side in a fashion that's consumable by the hospital's record systems in as little as 30 seconds. And that's really cool to be able to do. So I would imagine that within any given county or district that you operate in, you're going to have several primary facilities you transport patients to on a daily basis. What would happen is we would give those facilities access to their own patient portal, and then they can log into that and then access that, which would allow them to see incoming patients as quick as 30 seconds after the data has been entered into the ePCR en route, provided that there's internet connection between the mobile device and the cloud-based service that pushes data over to Beacon. This also facilitates the ability to pull from Beacon completed patient care records, as opposed to having to secure fax these reports from the station once the clinician has finished submitting them. Now, not only does this cut down on the time that it takes to complete these after documentation tasks, but even more, it eliminates the concern around faxing to unsecure locations, not to mention the degraded quality of a printout that we often see from documents that have gone through fax machines. MEDIVIEW Beacon will allow you to save it as a PDF, or more interestingly, a continuity of care document, or CCD. This CCD is an HL7 interoperable structured file whose contents can be consumed by the electronic health record systems used in hospitals, doctors' offices, clinics, and more. Now, BLT was the first company to enable CCDs to be exported from a NEMSIS v3 electronic patient care record in as little as 30 seconds. This means your data just doesn't sit in a PDF, which is basically just a picture of the record. But we also enable the hospital to consume the data into their Epic, Cerner, or other EHR system that consumes HL7 structured data. So, to learn more about MEDIVIEW Beacon, you can either visit us on our website, www.beyondlucid.com. Once on this page, scroll down to the MEDIVIEW Beacon Prehospital HIE logo, click on that, and this will take you to a page and provide you more information there. Or you can send us an email to sales@beyondlucid.com, and we'll send you some more information that way. This concludes our presentation on MEDIVIEW Beacon. Thank you for your time.